Hello, TMD Collective community. Welcome to another episode of Jaw Talk with me, Dr. Tiffany Lamberton. This episode of Jaw Talk, we journey into the heart of craniofacial orthodontics with a guest who I had the best time recording with, Dr. Kathryn Preston. She's founder and CEO of BiteSize. Through her company, she provides online education in niche topics for dentists and physicians, as well as public speaking, consulting, and expert witness services in dentistry. Additionally, Dr. Preston is a craniofacial orthodontist who has focused her clinical care on patients affected by cleft and craniofacial differences, working primarily in hospitals and universities. Dr. Preston completed her undergraduate degree in Spanish at the University of Kentucky, her doctorate of dental surgery degree at University of California at Los Angeles, her orthodontic specialty certificate and Master of Science degree in oral biology at Texas A&M University, Baylor College of Dentistry, and subsequent fellowship in cleft and craniofacial orthodontics at Seattle Children's Hospital. She's a board certified by the American Board of Orthodontics. Let's dive right into this great conversation with Dr. Preston. Quick legal disclaimer. All information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. Hey everybody, this is Dr. Tiffany Lamberton, and this is another amazing episode of Jaw Talk. I'm so excited for my guest this morning. She is Dr. Kathryn Preston, a craniofacial orthodontist, and so acclaimed, as you heard in her bio. She's also a fellow dog owner, so we're going to talk dogs at the end. So stay tuned through the whole episode. It's going to be a good one. So welcome to the show.
Thank you so much, Tiffany. I've really been looking forward to chatting with you.
Yeah, this is so great. You have a specialty in cleft and craniofacial orthodontics. And, I would just love to hear, your journey of like dental school. How did you get to where you're at in your profession?
It's a good question. And I'm sure so many of us have such incredible pathways, how we got to where we are in our careers. But for me, I actually studied Spanish in undergrad. So I knew that I would be going into healthcare, but I chose a language as my area of focus. I was interested in Spanish. I'd already been studying it, but also to develop it further. I knew that whatever path I went down in the future, that would be tremendously valuable to have the understanding of another language. So I focused on Spanish and Spanish literature, and then went off to dental school. I went to UCLA for dental school, and then I was there for 4 years, loved it. It was a wonderful experience. I had anticipated I would probably go into orthodontics when I started dental school, primarily because I was familiar with it already, and I liked the cerebral aspect of it. It involves so much planning and a lot of long-term care goals, which seemed at the time where my interests were. And I moved on to residency at Baylor, now Texas A&M in Dallas. And that was for 3 years. Also learned a lot. I was fortunate to have a lot of great, inspiring, and supportive faculty in my time there. I was introduced to cleft and craniofacial care in residency, which I think more now with students and new grads, they get exposed to it earlier than I was. I was exposed to it in residency through a rotation, but we didn't have much to do with actually the treatment of these patients. It was observership and didactic exposure primarily. And so I was interested in treating patients with cleft and craniofacial differences, but I didn't feel like I had quite enough background to dive into it. Also at the time, I wasn't sure if I would just go into traditional private practice like most of our colleagues do and love doing. So I got out of residency and spent a couple of years doing traditional orthodontics as well as teaching. And the desire I still had for cleft and craniofacial care was still there. And so I decided to go to Seattle Children's Hospital and do a fellowship. And I tell everyone it was the best year of my life. I loved it. And I know it's near to you. So it's a fantastic program, fantastic people. And I learned so much. it's truly a testament to, you don't know what you don't know. And I realized that when I went to a fellowship. And so that was another year of specific training in cleft and craniofacial care in a hospital setting. And I did that because I knew that I wanted my patient population to reflect a population that you would find in a care facility like a hospital. So I then, since that time, my patient population has been exclusive to cleft and craniofacial conditions, special needs, and medical complexities from the orthodontic perspective. So following my fellowship, I moved back to Los Angeles, accepted a full-time position at UCLA as their cleft orthodontist, and I was also teaching full-time. I was their pre-doctoral program director, also a position I love because I love teaching. And then ultimately moved here to Phoenix a few years later. And I began working at Phoenix Children's Hospital in a similar role with the cleft and craniofacial team until late last year, where I left to begin my own online education company. So all of that wrapped up into a very lengthy summary of perhaps where it is that I find myself now, but all fortunate, all stepping stones. And of course, in retrospect, you see how all the dots connect in your path to where you are now. I do, at least.
No, it's an incredible story, and I am so excited to talk a little bit more about, your journey as like the founder and CEO of BiteSize Education too. So, but tell us a little bit about like what's the incidence of cleft and craniofacial defects, kind of like worldwide, or even just in the U.S. What do you see as far as like that population?
Sure. It's a great question. And I think an important thing to remind ourselves is, of course, as we know, it varies state to state, it varies country to country, as well as population to population. And one of the key things to remember is patients with clefts can continue to live normal, largely unaffected lives. And it's not to say that they don't have challenges and have to go through a lot of procedures. I don't mean to discount that at all. They certainly go through a lot. And fortunately, we have cleft teams that are skilled in supporting them through those times. But I think the important thing to remember is that they are going to school, they are getting great jobs, they are holding wonderful positions, of course. And so simply having a cleft or a craniofacial condition does not make them different than anyone else. It does not make them any less capable at doing these things. In fact, I find them to be more resilient than perhaps someone who doesn't have those conditions, because they've had to go through so many different experiences that are unique to having those conditions. And it creates some really valuable insight and experience that they can impart and share among people who do not have those experiences. So I think with keeping that in mind, that's the beautiful thing about cleft and craniofacial care. You have the opportunity to be exposed to these unique patients and their incredible families and their wonderful supportive stories. And I know myself, I have been humbled so many times in getting to know these patients because I've learned so much about how I cope with challenges and how I see things in the world. So I think above all else, it's important that we keep in mind that regardless of where it is, wherever you are, we all have a lot to learn from each other, and especially from patients who have clefts and craniofacial differences.
So true. So true. And I'm sure their stories are so inspiring. And like you said, the resilience is incredible. Like, what would you say is like the ideal age for surgical intervention?
Another great question. And I think it depends on the surgery. So if we're talking about clefts specifically, there are multiple surgeries that happen between birth until age 10, as well as beyond. So if there's a case of cleft lip with a cleft palate, cleft lip is typically repaired anywhere between the first 3 to 6 months of life on average. And that's, of course, not something that I, as an orthodontist, does. I don't do that, but my colleagues that would be plastic surgeons, for instance, would typically be the ones to do that surgery. Now, I would be an example of someone who would provide the care leading up to that lip repair. That can happen with lip taping, nasal stenting, or nasoalveolar molding, NAM treatment. Then the plastic surgeon would typically do the lip repair in that 3 to 6 month age range. Then a palate repair, if there's a cleft palate in addition to that cleft lip, would happen approximately 12 months of age. And that is selected on average based off of speech milestones. So it's to try to get patients and kids on a track of getting them to be able to make certain age appropriate speech sounds. So that's what dictates that timeline. And then orthodontics takes somewhat of a hands-off approach until the age of alveolar cleft repair, if there is an alveolar cleft. Not everyone has an alveolar cleft, but that is typically repaired anywhere between, on average, 6 years of age to 9 or 10 years of age, sometimes a little later, sometimes a little earlier, depending on the patient as well as the team's care philosophy. But that's the average time that bone grafting would be done. Orthodontics is typically involved leading up to that time, doing some preparatory orthodontics. Expansion is a common thing that you might see that we do. Some patients also don't need any orthodontic treatment before bone graft. And then in the teen years, we might be looking at jaw surgery if it's needed to address their dentoskeletal malocclusion. When you have a cleft, that can affect the growth of the maxilla relative to the mandible, so you can sometimes develop an underbite. Mm-hmm. And if that's the case, then sometimes it's within the range of what orthodontics can correct, sometimes it's not. So if it's not, then that's when we're thinking jaw surgery, typically when patients are done growing, anywhere between 17, 18, 19, 20, even 21, depending on the patient. Of course, boys versus girls. Girls mature a bit earlier. We, of course, have our methods of determining skeletal growth age for these patients to know when would be the appropriate time to intervene surgically. And then, of course, there are other surgeries that we don't necessarily think of as dentists. They have rhinoplasties. They might have speech surgeries that have nothing necessarily to do with us and orthodontics. So there are a lot of different surgeries and adjunctive procedures that can be done even beyond where dentistry and orthodontics are involved.
Okay. And then what type of imaging do you try to employ? Especially you were talking about they tend to have that underbite, and you're thinking about, what type of intervention you're going to do for that AP deficiency. What type of imaging are you, utilizing? Is it typically like cone beam CT, or are you ever looking at MRIs of the TM joints to see, what's the soft tissue look like?
Yeah. So we have a lot at our disposal, fortunately, in this day and age. And we commonly will take two-dimensional imaging, just like any dentist, any orthodontist in a private office, even in a hospital, we might do something like that. So that involves in orthodontics, typically a lateral cephalogram, as well as a panoramic x-ray. Those are typically our baseline images for any patient, regardless of having a cleft or not having a cleft. Now, we also, or instead, might take either a limited field cone beam CT or a whole head CT. And of course, from those, depending on the field of view, you can construct a lateral ceph or a panoramic x-ray. But those are helpful in cases where we also want to evaluate the bone, particularly in cleft areas, so alveolar clefts. If we are checking time for bone grafting or checking the outcome of a bone graft, cone beam CTs are helpful. And if you don't have the opportunity or the ability to take a CBCT, there are ways to be able to evaluate bone grafts even with 2D images. It's just important to know which one. So I typically advocate for at least intraoral radiographs in that area, so periapical radiographs, not just a panoramic, but 2D is still possible and still very valid to be able to evaluate clefting if you don't have the option of taking a 3D. You have to use both or either correctly, of course. And then as for the joints, of course, we're able to see the hard tissue with CBCT. So the joint itself in terms of the bony structures, but then the soft tissue structures, like you mentioned, Tiffany, it would be something you would see with an MRI. Now, I wouldn't necessarily be the one ordering that. That could be an oral surgeon or the plastic surgeon that would be looking at that more in depth. But those, you're right, are important images to consider, particularly if you're looking at soft tissue as well as joints.
Awesome. Awesome. I love that. And then talk to us a little bit about, some of the growth appliances that you use when you do have that underbite.
Yeah. So when we have an underbite, that's something we call a class 3 malocclusion. And commonly it could be, so in a patient with a cleft, it's perhaps that underbite is due to something different than the underbite that would develop in someone who doesn't have a cleft. So if you don't have a cleft, it's not uncommon to see that perhaps the mandible has gotten too big. So the bottom jaw is too far forward, whereas the top jaw is in a normal position. When you have a cleft, it's usually the opposite, where you have the mandible in a relatively normal position, but the maxilla is too far back. It hasn't had the opportunity to grow forward, perhaps due to scar tissue from the palate repairs. When it comes to treatment of patients with clefts and they have underbites, first we have to decide which jaw is the issue. If it's the maxilla, then we might consider something like a face mask in the growing childhood years, anywhere between ages 6 to 9, 10 at the latest, because we want to harness that time of pliable maxillary sutures. So a face mask is something, it's a reverse headgear essentially. So something you clip on to an appliance in the maxilla, and with good growth, it should protract or bring that maxilla forward. Now, we wouldn't use that in every case or every patient, but it's not an uncommon appliance, particularly if you have something called a retrusive maxilla. It anchors from the teeth. So I think that's something to keep in mind, that if you have significant retrusion or significant posterior positioning of your maxilla, a face mask is not something that's in the toolbox to correct that. If it's significant, a face mask can bring it forward a small degree or direct the growth to a small degree, but we wouldn't be relying on that to address the full skeletal discrepancy if it's a significant discrepancy. Another thing to keep in mind is, even if we correct the underbite in the childhood years, we talk with patients and families how if we get the correction, it's very possible they can outgrow it and the underbite returns. So just to temper expectations, even if it's something we can correct with something like a face mask, that's still a possibility that it could come back later in the teen years. And if it's significant enough, perhaps even jaw surgery would be needed.
Okay. I love that. Well, and like I was saying, before we started recording, is like you have the opportunity to work really in that true like interdisciplinary team. Talk to us about like how you communicate with that team when you're working through some of these complex cases.
So I love this question because it also, my response, I think overarching, is the same regardless of the team that I've worked with. But I've learned that I've worked with 3 different cleft teams over the years, and every team has their own unique perspective on care. Everyone agrees that holistic care and comprehensive care in a team environment is the way to go. And I would agree with that. Perhaps the care philosophies differ depending on the team as well as training of those individuals. So I've learned a lot in the 3 different places that I have practiced as well. So I'd say for team care, an example of ways in which I might interact with other providers. For example, as a cleft and craniofacial orthodontist, I work extensively with surgeons as well as speech pathologists. And with a speech pathologist, for instance, they are helping us determine if a speech issue is caused by something dentally related. If it's not dentally related, what is the reason? And they help us figure that out. It's not uncommon that in patients with clefts, they have a structural issue that is not dentally related that leads to their speech issue. And in that case, that could be surgically resolved. Sometimes we in dentistry might make a supportive appliance, either in the interim or for the long term, depending on the issue. But it's not always that the teeth are in the wrong place. Sometimes other structures are not where they need to be or functioning optimally. As for surgeons, of course, we're helping with planning surgeries and coordinating care. We're also positioning teeth in a position that would then help optimize the surgical outcome. And we work, of course, with other team members. There's ear, nose, and throat or otolaryngologists that deal with airway as well, and audiologists that help our patients with hearing, and social workers. It's really an incredible team of providers at all these different facilities that offer cleft team care that are just wonderful in being able to deliver excellent care for patients as well as support families through these very long journeys that they have.
Yeah. And what would you say has been like the most successful like form of communication between the team members? How have you managed that?
That's a great question, because I think pre-2020 and post-2020, the communication is different, because so often now everything's online. Up until 2020, I remember doing team meetings in person, and then everything went remote, and team meetings where we would then discuss patients then went also remote. So we all became reasonably proficient with, platforms very much like this, where we would have conversations very much like this, talking about patients. So in a lot of ways, I think going remote has been helpful in that we can readily screen share records. We can screen share images and look at it together as a team. Whereas unless we were in a conference room that supported those capabilities before, when we were in person, that made it a little bit more difficult, or maybe something we made a note to ourselves, I'll look at this later and then email this person back. Now I feel like, at least with tech platforms that we use now, where we can more readily look at this stuff in real time, discuss it, make a decision, and have that be perhaps a more efficient process now that we're all a little bit more comfortable with the tech aspect of interdisciplinary care. But that's a great question.
I love that. Yeah. Yeah. Hi there, I'm Dr. Tiffany Lamberton. I'm dropping in with a quick friendly note before we jump back into our podcast. Let's chat for a moment about mentorship. If you're a dental professional wrestling with TMD cases that you're really struggling to get it, I understand. The complexity of diagnosing, crafting those detailed treatment plans, and ensuring your patients are comfortable, it's a lot, isn't it? Here's the good news. You don't have to manage it alone. I'm here to offer a helping hand with my personalized one-on-one coaching and consulting services. Drawing from my rich experience in temporomandibular joint disorders, as well as my physical therapy background, I'm all about guiding you through these challenges with ease and confidence. Think of me as your personal mentor, here to bolster your TMJ management skills. Together in our sessions, we'll dive into the practical know-how I've gathered over the years. From strategies to helpful tips, I aim to streamline your practice and enhance your effectiveness. The best part, our sessions are super flexible and designed to fit right into your busy schedule. We'll focus on comprehensive learning, and that's not just about TMD, but also touches on improving patient communication and growing your practice. So no more feeling overwhelmed by TMJ patients and TMJ pain. With a bit of teamwork, you can boost your experience and confidence. Ready to take that first step? It's easy. Just swing by tmdcollective.com/VIP to book your first session with me. Let's team up to take your TMD management skills to new heights and really elevate your practice. Your path to becoming a TMD expert starts now. And now let's get back to the show. And what type of platform do you use, like Epic software, or what type of software system does your team use?
Yeah, I have had the good fortune and the not good fortune of being very familiar with medical systems and hospitals. And that, again, I've been with multiple teams over the years, and they all use different softwares because it's part of the hospital. So we have not really used dental softwares because they're not integrated into hospital systems. So household names as a dentist that you might hear for your practice management software, we don't have. So, so yes, I've used Cerner, I've used Epic, I've used dental school softwares, I've used others as well, and they all have their own nuances, of course. The benefit of that is that typically you're able to then communicate more readily with other care team providers because they are also members of the hospital versus being in two entirely different systems or different charts. So that's one benefit of figuring out how to use the hospital systems to your advantage to coordinate team care. Though, of course, I can't tell you the number of times where I'd say, it would be really nice to have an odontogram in the software or some type of platform in or module in this platform that's a little bit more conducive to dentistry, but it's okay. Maybe in future updates,
Yeah.
there
Well,
will
and
be
that
something.
was fair for me to like pick on like specific ones, but just love your opinion about that.
I love them all for their own reasons. It's actually remarkable how vastly different they are. Of course, the overarching category of that they manage notes and communications, they all do, but the way they do it can be quite different. So it's taken a lot to get to learn about it.
Yeah. Yeah. Okay. Well, talk to us about BiteSize PLLC and your educational platform. I love the idea of compressing small bits of information. Yesterday I was talking to a bunch of UW dental students. We were doing some, dental action day here in Washington State in Olympia.
Mm-hmm.
And I was like, how are you guys learning? Are you like, if you have a procedure on clinic, like what tools are you utilizing to prepare for that? So where did like the idea of, kind of BiteSize come from?
So I thank you for bringing this up. You can probably tell from the look on my face. I am so thrilled about BiteSize. It's really been an idea in the making for quite some time, at least in my mind and my goals for the future. And now we're finally here. So as I mentioned earlier, I love teaching, and I've been fortunate to do that in various places in different capacities. And of course, I know my experience as a student, and we've all been students for so long. I know, particularly, obviously, as you know, Tiffany, when you go to dental school, it's not only are you a lifelong learner, you still reflect on the fact that you spent 8+ years in higher education to get where you are. And so for me, it was 4 years of college, 4 years of dental school, 3 years of residency, and then 1 year of fellowship. And I love learning. I loved all of that experience. And I found that when I got out of formalized training programs, there's an abundance of continuing education out there, a lot of which is great. There's also some that I found I was disappointed in what I thought I would be getting out of it, in reading the description. And then I felt like what I got out of it was, for lack of a better word, a lot of fluff or a lot of theory or something that I couldn't apply. And I even hear similar things, perhaps even from dental students, that say, I'm learning a lot about the technical aspects of providing care, but I don't understand branding. I don't understand how to make my clinical skills work for me and develop a business model from something like that. So I think as we get out, we recognize again that concept that I brought up earlier, you don't know what you don't know. And my goal with BiteSize is to make it accessible, make all this education that's what we consider sort of out of our reach or out of our scope. I want that to be accessible to us as dentists. Our motto is dental education for the modern learner. And it's not to take the place of dental school or residency or higher education like that, which is still critically important. What we're looking to do is fill the void that exists in today's education, whether you're in school or out of school looking for CE. We're looking to fill the void in these unique topics. Like, for example, yesterday we hosted an intellectual property attorney talking about, if you have a great idea, what do you do with it? Because I know I wonder that myself. So a lot of this stems from my own questions about, well, what if I had an idea for a product? Who would I go to help me get that off the ground? But when we're thinking about intellectual property, for instance, we're thinking perhaps bigger scale, like healthcare startups and big companies that develop from healthcare startups. We think of that when we think of intellectual property. And we did talk about that yesterday. But I think the important thing to remember is that we all have intellectual property. Even if we're a small business owner, even if we are only in private practice, the things that you do every day, even in developing your logo and developing your slogan, your practice materials, all of that is your intellectual property. So how do you protect it? What's the value in doing that? And I think that that is a unique topic to consider, whether you're a small business owner or a large company. Now, for BiteSize, we also offer courses in niche, unique, modern topics. I have released a course on cleft diagnosis, which the story behind releasing that course is, as I got out into practice, I realized all that the provider community just didn't have access to, that I was fortunate to have access to, having done a fellowship. How do you look for a cleft? So commonly we learn from people above us in more of an apprenticeship model about these topics. But I think we need to go a step further and recognize, where are we in our evidence-based knowledge on these topics, particularly the clinical care, and then develop more on that. And when it comes to cleft diagnosis, we have a lot left to go. We have further to go in how we determine our protocols, how we determine our evidence-based practices. So my goal with this course was to make it easily digestible for all providers, whether you're a specialist or not.
General dentist.
Okay, no fluff. Yes, and general dentists especially, who are important members of these teams. No fluff. This is what you need to know. These are the tools you need. And that's the course. So it's built in 20-minute modules. And that's the bite-size component of it. So I recognize that that's a long answer to your question, but I think our goal really with bite-size is, we don't want to be just another online course provider or another online dental resource provider. We're focusing on niche topics for the modern learner in 20-minute modules. We have live sessions with industry experts where we're asking these questions about how you can apply this information to you, your life, and your business. And that's what we're looking to bring full value to all of our members.
Yeah, I love that. Well, and I just got my patent for TMD Collective, and that was like a 2-year process. I can.
I know it's a huge deal. Congratulations. That's a big deal.
I know.
That's not an easy thing to do. That's wonderful. Congratulations.
Thank you. Well, and like you said, as a general dentist, I have no idea about, how do you do this, and like, how do you find the right person? And in my case, I was so fortunate because I had actually a TMJ patient who I was like talking to, and I was like, this is my vision. I want to create this. And she was like, oh, you need to meet, she was a she was like, you need to meet the lawyer that I work for. She's the best. And so I actually like ran into her when I was like picking up some wine last night, and I was like, I got it, like, let's pop some champagne. So, that's something that in dental school, we heard nothing about branding or intellectual property, or like, how do you create that unique story? How do you protect your, like you said, your business models? So I love that you're providing that information to other dentists and other orthodontists, because I think that you have to be able to stand out in today's world.
Absolutely. And everyone has something worth sharing. And the key is, if you have ideas, how do you share it and protect those ideas? How do you make something that you can be proud of, that you can then get, even if you wanted to bring something huge to market, let's say, who would you go to do that? I certainly didn't know that. And that was what led us down the path to having an intellectual property on yesterday evening for this session. So we'll be having sessions in the future about other things like employment law and the nitty gritty with branding from a marketing perspective, because of course we've talked about it from a legal and intellectual property perspective yesterday evening, but now we're going to be transforming the issue towards, okay, so we recognize we need to protect our ideas, but how do we generate those ideas to begin with? So these are all really exciting topics, I think, for not only myself, but general dentists, specialists, students, residents at any point in your career. I think we all recognize how important our traditional clinical skills and education are, but building on that to develop those niche subspecialty clinical skills through courses that we'll be offering, but also business skills and business acumen that we wouldn't necessarily have the knowledge base to even go and find those answers. So that's what we're looking to bring to BiteSize members.
I love that. Well, and please do one about how to monetize that, because what I was telling you is like, I've recorded a few courses, and like, you can have the best course in the world, but like, if nobody's buying it, you're not getting any sales. Then it becomes like a hobby and not like a, part of your, part of your profession.
I think that it's a great point. And I received some really interesting advice from someone not even all that long ago as I'm developing BiteSize, to answer this question. And I think we all need to answer this question when we're thinking about even when we're developing lectures that we're going to give. If we're coming up with an idea or a product or a course or something, we have to think, if you speak to everyone, you speak to no one. And I think that was really helpful for me to hear, because you think, well, I want to make something that is inclusive of everyone, that everyone's going to find interesting. But then you don't really get specific enough on any particular issue or topic or question for it to be providing any real tangible resources, I suppose, for any particular audience. So I think what you're doing, Tiffany, is great. You have very uniquely defined jaw talk. There's no question what it is that you talk about. And I think that serves you well. And that's what we're doing with BiteSize as well, where we are speaking to the modern learner in the sense that they are interested in these modern topics. They're interested in doing better, learning more, and doing it in an efficient fashion with 20-minute modules, the way we sort of all learn these days, with everything being quick and easy to access. We want to bring education into the modern world, and that's what we're working to do. So yes, by speaking to everyone, you speak to no one. So we are speaking directly to anyone who is interested in learning these skills in a modern world in an efficient and unique way.
I love that. Well, and for me, I had to realize like the people I actually want to talk to are other healthcare providers. This isn't really, I may have some listeners that are, just kind of in the general public, but like, I guess, even without meaning to, I've focused more towards like healthcare professionals, other dentists, dental specialists, ENTs, I know I have a PA that's listening, so that was kind of like, I had to think about like, who do I really want to, speak to, and who's my audience. So,
Sure.
What I hope is that you're listening to this while you're walking your dog. So let's talk dogs. You have an adorable mini poodle, Edison, and I have an adorable Cavapoo Wookie. So if you haven't checked out our little puppies on Instagram, you need to. Talk to us about how you became a dog mama.
Just like my career, I think my journey to being a dog mom has been just as long. So we got Edison only a couple months ago, and my husband and I have been talking about getting a dog for 10 years or so. And we felt that we just weren't able to give or provide the life for a dog that we would want, in terms of being home enough or having regular enough schedules to take care of a dog. And my husband also was very adamant that we have a yard, and we still don't have a yard, but he at least exchanged that for at least having more time to have a flexible schedule with him at home. So we brought Edison into our home late last year, and I cannot tell. I mean, I'm sure you have kids, so you learned this lesson earlier, I guess, than I have learned this lesson. But taking care of another living being that's not your patient, but taking care of another living being that comes into your family just rocks your world. And I love this little guy so much. And he's taught me a lot about myself in terms of letting things go a little bit, giving him the ability to make his own decisions about some things, and I recognize that we're all about dog training. Fortunately, he potty trained in 2 weeks, which is fantastic for me. But also, he is nothing but pure love. And I remember it was probably the first 3 or 4 nights where I was really I was worried sick about him. He didn't say dogs, but he didn't make any noise for days. When we first got him, he didn't make any noise for days. He didn't woof, he didn't bark, he didn't growl. He was very quiet, and that concerned me. I think also because at the time, that's not what I expected. So even still, just it's a lesson in life showing you that you come in with expectations to a certain situation, and then what it ends up being is entirely different. And over time, he's really let us see what his real personality is. And he is so much fun. He's very animated and audible. He will let you know he's in the room now. But at the start, it did concern me, and I was worried about him. I was worried for him, and a lot of sleepless nights at the beginning. And now we've all settled into a rhythm and gotten to know one another, and we're all very comfortable with each other now. And Edison has been such a blessing in teaching me about how you come in with your thoughts about how things are supposed to go, how your life is supposed to go, and then
it's turned on its
takes
head.
off in whatever direction it's going to take. And no matter what, it's great. And it's even better than we had thought it would be. So we're really fortunate. And I'm sure you feel similarly about Wookie. I mean, they're such gifts, these dog children. So he's actually under my desk right now and just snoozing. So I was wondering if you would hear his squeaky reindeer in the back of all of this, but he's being very professional.
Yes, he is. He is. I had to shut Wookie in the downstairs room in my son's room because he would not be so disciplined.
The only way he will stay quiet is if he's at my feet. So
I love it.
He's trained me, I think, is a great way to put it.
I love it. Well, tell us a little bit about what you're excited for in the future. Give a shout out right now when we'll link all of these things in the show notes, of course, for our listeners. But if you have another mastermind coming up or a lecture you're giving, or tell us what you're excited about.
Thank you. Yeah. So we're developing a lot at BiteSize. We've been recruiting additional instructors. So up until now, I've been the primary course deliverer for, for example, my Essentials of Cleft diagnosis course. That's a lot of radiographs and clinical evaluation in a 1-hour course for patients with clefts. And we're going to be evolving our topics and evolving with our instructors as well. And we'll be releasing some in the next couple of months, which is very exciting. We're aiming to do monthly live sessions, very much like we did yesterday on intellectual property, where we had an attorney come on and even interact with the audience. I think that was very helpful, as well as a great way to get people thinking about, well, what are my questions, and have the opportunity. When do you have that opportunity to come and ask questions like that, particularly with such ready access to an incredible attorney like we did yesterday? So we had that yesterday. We are now in the month of February. So starting again in March, we'll be having another session. I'm not releasing the topic quite yet,
Okay. You're gonna
but we will
keep a
be
tease out
releasing
for
it
that.
in the next few weeks for sure. But it's really exciting. Again, niched, unique, modern topics for our live sessions, just as we'll have in our recorded courses as well. So I'm excited about the growth of BiteSize. I am very excited about the colleagues in our community that it's not only helping, but then I'm connecting with. I wouldn't have had the opportunity to get to know any of these incredible people had it not been for BiteSize or connecting through the courses that we offer or the live sessions that we're now offering. So it's a great way in building that community as well. And like you said, speaking with other providers, whether they're in your direct discipline or not, is an incredibly rewarding experience. I know I've grown a lot. My perspective has changed. My treatment philosophies have even changed. So we all can learn so much from each other. And that's what we're looking to do in this bite-sized community.
I love that. I love that. Well, Dr. Kathryn Preston, thank you so much for being on the show today. And like I said, we'll link all of the information in the show notes for our listeners. But thank you so much again for your time and your expertise. This has been such a fun conversation.
Thank you, Dr. Tiffany. This has been fantastic. I've enjoyed every second of it, and Edison has as well.
Wonderful. There you have it, another fabulous episode of Jaw Talk. Thank you so much to Dr. Kathryn Preston for joining me on the show. If you haven't started to follow her on Instagram, BiteSize, you need to go follow her and also look into all of her craniofacial courses. They are fantastic. As we wrap up today's episode, I want to remind our listeners that Jaw Talk thrives on your support. If you enjoyed our deep dive into the world of dentistry and orthodontics, please consider supporting our podcast. Your support helps us continue to bring in amazing guests like Dr. Preston and cover the topics that you care about the most. Don't forget to check out the show notes for links to Dr. Preston's work and how you can dive even deeper into the subjects we discussed today. And always, if you loved what you heard, please subscribe and leave us a review wherever you get your podcasts. Your feedback not only helps us improve, but also helps others find us. And if you'd like to see Dr. Preston and I do an IG Live with our adorable puppies, Wookie is mine and hers is Edison, please drop me a DM on my Instagram account at tmd.collective. All right, everyone, have a great day. Stay humble and stay curious.